my name is Dudusha Arami and I'm the Director of Public Health here in Enfield. So once again, welcome to the session. I would really just like to emphasise that this is the aim of this session is to provide you with accurate, up-to-date information about the vaccination of children aged between 12 and 15. The purpose is really to inform your decision about whether to have your own children vaccinated. Before we get into the question and answer session, Louisa is just going to talk you through how the webinar is going to run today. And then you will hear a little bit of information from Belinda about how the vaccination programme in schools is working. So, Louisa, without further ado, over to you.
Thanks, Dudu. So hopefully you can all see the screen here. So I'll just run through some of the ground rules before we start the webinar. I'm sure you're aware that your cameras and microphones are turned off. So only those of us on the panel will be able to speak, but we really do encourage you to put any questions or comments into the chat, which you can access at the top of your screen. So please do write questions in there and we will do our best to answer them throughout the session today. Please be aware that the webinar is being recorded and it will be published online afterwards. So if you did miss anything or want to hear our answers again, then you can access it and it will be available at Enfield Council's website and social media pages. We do ask that you only post relevant questions into the chat, please. So do avoid putting the same question that's already been answered or asked, and instead just give a thumbs up, and that way we know which questions you'd like answering. Please do avoid posting any external links or offensive content into the chat. But aside from that, we hope you find the webinar really informative, and I'll hand back over to Dudu and Belinda. Thank you.
Thanks, Louisa. And so over to you, Belinda, just for a run through about how the vaccination programme of 12 to 15-year-olds works in Enfield schools.
Thank you very much. Okay, so if I can just start with just a tiny little bit about how vaccinations or vaccines work in general. So all we're doing is introducing a small amount into your system, and then your body kind of makes its own antibodies in reaction to the vaccine. And then if you encounter the disease, it will be able to help you to fight it off. So in relation to the COVID vaccine, the vaccine is not going to make you immune to catching COVID. What it will do is just give you a fighting chance so you don't get as ill as you would have if you hadn't been vaccinated. So for the age group that we're talking about, what we're using is Pfizer. And at the moment, you can have a first dose of the vaccines, which we started back in September. We're now delivering the second dose of the vaccine to 12 to 15-year-olds. And there's been no announcement on the booster just yet. So what my team are doing, so the team of nurses and support staff are going into every school, secondary school in Enfield, and we're on about 42 sites, I believe, over the next few weeks, up until the end of February. And this is the team that are already delivering flu, HPV, and all the other school age national programme to your children already. And we're additionally doing the COVID. So they're very experienced, lots of senior nurses in there, and they are used to doing this. This is what they do day in, day out. So all eligible 12 to 15-year-olds, and if you have an 11-year-old and they're not quite 12 yet, we won't be able to deliver, but we'll keep an eye. And the minute they hit their 12th birthday, and if we're still in schools, we'll be able to do that for you. So once you've had the first dose in this age group, we're given a gap of about 12 weeks before we give the second dose. So what we'll do is the school will send out a link, and I know that some of the schools have already had this because we started on Monday the 10th. We've sent a link to the school. They'll share it with all our parents. There'll be a special code and you enter it online And if you don't have internet access, don't worry. We have a telephone number that Louisa will give at the end. You can give us a call and we can sort out the consenting process without the computer. But if you do have access to the web, you'll get a special code that you will enter, and then it will ask you a series of questions, most of which is the same that we ask for flu and the other vaccines. Has your child had a COVID positive test in the past 12 weeks? Are there any medical issues that we need to know about? And so on. So once you've consented, that will come back to my team. They will go through it. And please know that we are not delivering COVID vaccinations without the consent of parents. We're not going by the children, we're going by you. So even after you've consented and you want to withdraw, you can do that. On the day of the vaccine, we ask the young person again, and if for any reason they don't want to go ahead with it, we will not deliver it. If you've consented to flu or any other vaccinations, we will not give COVID. We consent for each individual vaccine, and that is what we will deliver for you. I must mention that we also have some additional half-term clinics in case you want to be there with your child, especially for the younger ones. I know that Louisa will post that on a council website, and we've got clinics all through half-term. So from the 14th up until the 18th, and we'll be doing flu and COVID in those sessions as well. There is also the national booking system that's available to everybody. So though we've got the in-school offer, you can also book outside of school. And there are some of the large vaccination centres. I know Highgate in particular has been very, very busy and very experienced in giving vaccines to this age group. So the link again will be shared and you'll be able to go on there. You can book for your child to be vaccinated and you can turn up with them. You can consent while you're there and your child will be vaccinated. I should say, just before I finish off and we go to the questions, that we've done really well in London. We're now at around 36% of this age group have been vaccinated. And for the 16s and over, 16s and 17-year-olds, we're now at 31%. And so we want to try and do better for the second doses. So please, you know, any questions that you've got, you can contact my team directly. You can contact Dudu, you can contact me, and we're happy to answer any of your questions. Thank you.
Thank you for that, Belinda. We've got a great question in the chat. First off, which vaccine is given to 12 to 15-year-olds? And actually, this vaccine has been answered by Paul in the chat, which is Pfizer. So welcome, Paul. You are part of our vaccine leadership team and work in our with our primary care colleagues in pharmacy. So Paul is well versed in all of the vaccine related information. So thank you, Paul, for adding that into the chat. There's a great question here as well about what the risks are to giving the vaccine to girls aged around 14 to 15, particularly during the stages of puberty, and is there any risk about fertility? Belinda, do you want to take that one?
Happy to take that one. So this is a question that has been asked quite a few times throughout the programme. There has been no reported side effects to that particular age group to the Pfizer. For pregnant women, we're actually advising that they do get vaccinated because we have had quite a few pregnant ladies that have been affected by COVID. And in the past couple of weeks, we've had under 1-year-olds who are being admitted to hospital who have contracted COVID. And I think it's particularly when the Omicron variant came in, because it's so transmissible and children are super spreaders, as we all know, it has been going around. So the advice from JCVI is, and the chief medical officers, is that pregnant women should get vaccinated. For the side effects that you were asking, particularly for that age group, there has been none reported other than the normal soreness on the sites of the vaccination, sometimes within the first 48 hours, headaches and flu-like symptoms, and most people recover from that fine. And that will be the same as your flu vaccine as well.
I think it's also important to add that many thousands of women of childbearing age have received the vaccine and gone on to have full-term healthy pregnancies as well. So there haven't been any fertility related issues identified in relation to any of the vaccines. So again, that's an important point to make. But it's a great question because it's obviously an important matter to people. So I'm just having a look at the rest of the chat. Just to confirm, yes, you can use the National Booking Service for booking the vaccines of 12 to 15s, and we've put the link into the National Booking Service there. So you've all got that. And there are certain walk-ins that have been happening across Enfield and in other boroughs as well. And they will, many of those are 12 to 15-year-olds are also able to attend, and it will likely say on the information for the walk-in whether that's appropriate for 12 to 15-year-olds. So again, there's lots of places in which 12 to 15-year-olds can be vaccinated, but obviously school is very convenient. It doesn't, you don't need to take them anywhere, and you know, they'll be doing that with their peers as well.
I should add, Dudu, that one of the great things that the National Booking System is doing is that they do put time aside, particularly for that age group. So specifically between 3 and 6 after school, they are putting time aside. So the minute you put in the age group in there, the computer's very clever, and it kind of moves you to a time where they know that that will be the traffic that will be going through. I'm really glad that you mentioned the in-school offer being the best place to do this, because they're so experienced, and you know, we know how to make children feel relaxed before the vaccine. I know that some children have needle phobia. Our team have been very well trained in how to manage those situations.
Great, thank you, and thank you, Louisa. Louisa has posted in the chat the link to the North Central London schedule for walk-in vaccination clinics. So that's a schedule of walk-in clinics that are happening across Barnet, Enfield, Haringey, Camden and Islington. So hopefully there will be availability there that is convenient for everybody on this call. Just having a quick look through, and I think that we've answered all of the questions in the chat so far, so please do feel free to put more in. Okay, thank you, Kilner. So a question about what other countries are giving vaccines to this age group and how long have they been giving them for. So I know Israel and the US were among the first countries to provide vaccination for this age group, but there have been many countries who have since followed suit. I think in the US, a process first made vaccine available in May or June to over 12s, and more recently the vaccination has actually been approved in the US for over 5s as well. So many thousands of children of this age group have been vaccinated across the world. I don't know exactly how many, but there are lots of countries now, including the UK, Canada, countries in Europe who are now following suit. So there is a very significant body of evidence indicating that this is safe vaccination and effective in children as well. So I know that Louisa has also prepared a list of questions that I hope that you'll be interested in hearing. Louisa, what's the first on your list?
Thanks, Dee. So yeah, these are commonly asked questions that people are really keen to know the answers to. So the first one is more of a practical one. So if a child has recently tested positive for COVID-19 and they may have booked their appointment, but now they've tested positive, how long do they then need to wait before they can have their vaccine?
I'm happy to take that. So the gap initially was 28 days. That was revised late in December, I think, and we're now leaving a gap of 12 weeks. So usually when you're doing the consent for the in-school offer, that is a question that we do ask if your child has had a positive PCR test or has been infected with COVID. And what we do, you can go ahead and consent anyway, but what we will do is keep that back. We'll make contact with you and then we'll book a date that's a lot further than the dates that are currently being offered. So quite a few, in fact, 2 of the clinics during half term are being taken up by those who were originally booked in school but contracted COVID. So we've now had to move them to February. So yes, the gap is 12 weeks.
Okay, thank you. And so when the time is ready for a child to have their vaccine at school, what can they expect on the day? Because I understand parents won't be present, so it might be helpful for them to know what their child can expect.
Yeah, that's a really, really good question. So, I mean, initially, during the first delivery of the first doses, there was no chance of parents being in school because it was quite new, not the vaccine, but in terms of the delivery format for us. I know that recently myself and Dudu and the Director of Education met with some heads who may be willing for parents to come into school with their children. I know that obviously the 13, 14, 15-year-olds might not be too impressed with that, but the 11 and 12-year-olds might be interested in taking up a parental offer of accompanying them. So what happens on the day is, it's like all the other vaccines, and we honestly cannot do this without the school. The schools have been so supportive. We get a class list. So we've got the consent list from the portal that I spoke about earlier on, and then we get a class list on the day from the school, the teachers, that will help us to marry it up against the consent and work out who said yes and who said no. And then with that, the school will bring down the children to, and it's usually the hall where they have their assemblies or the canteen, somewhere that we've set up safely. They'll bring them down. Usually the senior nurse will speak to all the children in their group, socially distanced where we need to, about what's about to happen. And then you usually have a few stations where the child will be called up and will verify their identity. Sometimes some of the older teenagers like to do a bit of a mess around, but the teachers know them very well, so they'll let us know if Tom is not really Tom. So we'll go through the identification process, and then obviously they'll go to a nurse who will then go through the consent. So though I'd mentioned earlier that we're only taking parental consent, the children still have autonomy over their body. And, you know, on the day, for whatever reason, they may not want to have the vaccine. We'll go through that process with them. And if they say no, obviously we'll come back and we'll have a chat with the parent later on. They'll go ahead, they'll have the vaccine. The 15-minute observation period for children has been paused in the same way that it has with adults, but they usually have to sit down and wait anyway because the teacher has to escort them back up to the class. So it's kind of by default built in anyway. We have fainting mats. Most nurses will know what that means. And if any children are feeling funny after the vaccination, they'll be sat over in that corner and they'll be well looked after. We do have refreshments sometimes. Sometimes some of the children would like some orange juice, something with a bit of sugar in it. to perk them back up. Most of them ask for lollipops, and we don't provide that anymore, unfortunately. But it is a very uneventful event. They're very well looked after, and then the teacher takes them back up to their classroom. And then obviously we ask you parents, when children come home, observe them for the next couple of days. If they have a temperature, there's the usual paracetamol, as you do when they have any other medical intervention.
And just to confirm as well, once a child has been vaccinated, it's a little bit unclear, isn't it? Can you hear okay?
I can now.
Once a child has been vaccinated, the parent will receive an email to let them know that's successfully happened.
Absolutely, yes. We used to have certificates that we used to give to the children, but we've become very modern now, and it's all electronic. So you'll either receive a text or an email prompt to let you know that the child has been vaccinated. Obviously, all children under our care have clinical health records, and that will be recorded there as well. So should you need a copy of that, if you haven't had a text or an email, contact my team and we'll get that to you.
Great, thank you. We've got another question in the chat. Once a 12 to 15-year-old has had a second vaccine, do they automatically need a booster once that is approved? Or with the Omicron variant going down, can this age group get by without getting a booster? And Belinda, I think I'm right in saying that boosters have not been approved for this age group. And whilst that may be something that happens in the future, at the moment, we can't really comment on that.
Yes, thank you. You're right, Dudu. So the cohorts are separated into, you've got healthy universal 12 to 15-year-olds who are having a first dose and a second dose. No booster has been approved for them. But for that same age group, if they are immunosuppressed, they're extremely clinically vulnerable, they have a medical condition, they can have the booster. That's been approved just for that age group.
Belinda, how would a parent automatically know that their child is within that category?
They will, because a lot of children in that category will either be under a consultant or they're being kept an eye on by the GP. But if you're not aware of this, the GPs have been tasked, all local GPs have been tasked with going through their clinical list, their GP list, to identify these children, so the GP will make contact. So for those who are clinically extremely vulnerable, it will not be the school age immunization team that will be doing it. We won't be delivering this in school. The GP will call you up and you will go and have it done. For some of our extremely vulnerable children who attend special schools in Enfield, we are delivering the vaccine in the special schools, but that will be a liaison with your GP, and either ourselves or the GP will make that decision as the best place to vaccinate your child. And for some of these children, we've done home visits because they're more comfortable in their home environment with their parents there.
That's really helpful to know. Thank you, Belinda. Louisa, I know that you've got some more questions.
Yeah, that's right. So
send them over.
As we've been talking about the process within schools, be interesting to find out what the process is for those children who are home educated and do not attend school, how they are offered the vaccine.
That's a really good question. So we're called the school age vaccination service. So whether the child is attending school or they're not, they're going to a different establishment, or they're being home educated, they are still school age. So there's still our responsibility to vaccinate them with COVID and with other vaccines as well. So we usually by September get a list from the schools or from the local authority that will let us know that these are all the children who are being home educated, and we usually send out a letter to these children, to the parents, to let them know about all the other vaccinations. But we've also done that with COVID to give them equal opportunity to have the vaccination. What we're doing is bringing them into our clinic, so either the half-term clinic, and we've done some Saturday and Sunday clinics and also after schools. So if the parent contacts the team, there will be a contact number and email on the letter that's been sent to all the homes. Contact the team and we'll make arrangements as to the best place to do it, because some of the children who are home educators, sometimes they go to a centre maybe once or twice a month. So depending on the arrangement for the child, we'll make the correct arrangement with the parent, and we'll go through the same consenting process as well.
Sure. That's really helpful, Belinda. And I suppose the important thing is to note that any child at age 12 to 15 can have their vaccine somewhere that's convenient and easy for them. So that's really good to know. So just in terms of a child that may have allergies, can they still have the vaccine?
We haven't had any contraindications to allergies. If there is an allergy that a parent is particularly worried about, they do need to let us know and let your GP know as well. And that's one of the questions that we ask on the consent forms about the medical conditions and any allergies. So far, there hasn't been any that has been identified as contra to the Pfizer vaccine. But obviously, you know, people have individual situations that is always good to have that discussion with your GP or with the nurse. There is a provision for the extremely vulnerable to be referred by the GP to a specialist centre, but that will have to be extreme. Most children with asthma, other allergies, we've been vaccinating them. And as Judy said earlier, all over the world, not just in England, and they've been absolutely fine. But have that individual conversation with your clinician.
Great, that's really clear, thank you. You mentioned earlier you'll be running COVID-19 clinics as well as the flu vaccine clinics. So is it safe then for a child to receive the COVID vaccination and the flu vaccination at the same time or within a short period of time? Because I know some may be worried about the side effects from both.
Yes, yeah. So there are two things in your question there. Yes, we can, is what we call in the trade as co-administration. So we can administer COVID and the flu vaccine at the same time, obviously one in each arm, so that we can identify where the soreness is coming from. But also for children, for all the other vaccinations, we've been given sign-off by the MHRA to co-administrate with. So in most of your schools in January and February, you're going to have HPV 1 and 2 being delivered by my team. And if we come in for those and you've consented, only if you've consented to COVID, we can administrate that as well. The second part of the question, I think, was about side effects or contraindications. Will there be any issues in doing the both? We are, and I'm really proud of this, in England have got a brilliant reporting system. It's a national reporting system that we call locally as or nationally as the yellow card. So the yellow card system. So anybody that's having any vaccination anywhere in England, if there's any side effects, it's reported immediately into that system. And the general public can make those reports as well themselves if they have a side effect. But you can always call my team and we can do that. And we're able to, as clinicians, have a look on there. Obviously, it doesn't reveal people's identity, and it will tell us the most common forms of side effects. So far, none associated with having flu and COVID, and most of the side effects has been temperature, soreness, and the general flu-like symptoms.
That's great. The more we can promote children having both vaccines, we know how important it is, especially over the winter period, and it's great to know that both are available for them. So moving to a slightly different train of thought, is the vaccine suitable for young children and young people who do not eat animal products, or who may be vegan or vegetarian or observe Muslim or Jewish faiths?
I'll answer partly, and I think, is it Kilner that's on there from pharmacy may be able to answer some of it, but yeah, in a nutshell, wrong analogy to use when we're talking about allergies. Yes, there are no side effects. There are no animal products in the vaccine, and we have quite a large population of Muslim and other faiths in Enfield who we've been working with for many years in relation to flu, actually. And they can have the vaccine, and the Jewish faith as well. Obviously, have a chat with your cultural leaders if you want to have that discussion, and we're always available to have those discussions, but you can have the vaccine.
That's brilliant, and I will post some information in the chat from the British Islamic Medical Association, who have been advocates of the vaccine and who explain quite rightly, as you said, Belinda, that there's no animal products, alcohol, etc. in the vaccine. I think that is really reassuring for people. So just had a final couple of questions. So if you've had the COVID-19 vaccination, can you still transmit the virus?
Yes. So, and one of the questions when I'm speaking to people who I'm not going to call anti-vaccinations, but who might be just a little bit hesitant and might be a bit worried and just want more information, has been, why should they take the vaccine if it's not going to stop them from catching it?
Sure.
So there is the answer. So the vaccine, none of them will stop you from catching COVID. What we're doing is trying to reduce your chances of getting extremely ill or ending up in hospital and on a ventilator. That's what we're trying to do. And no, there are, as I'd said earlier on, we deliver lots of other vaccines for this age group, and also my adult colleagues as well. And there is no vaccine that's going to give you 100% protection, but the COVID vaccine has been known to give really good protection. So we all know people that caught it over Christmas. I don't think I know one person that wasn't affected in some way, shape or form, but if they were vaccinated, they had a better chance of fighting off the worst effects of COVID. And for children, the other question that we get asked is that they are healthy, 12 to 15-year-olds, they haven't been known to fall seriously ill with it. I would point you to the effects that it's been having on their education and their socialization. Lots of schools have had to shut down. Lots of teachers are not able to go in because they're isolating. And there's been a big interruption to the children's education, to exams, and just in general for them to grow and develop as they should if we weren't in this awful pandemic. So they spread. Children do spread COVID quite a bit. They may not get ill, but they're spreading it to their grandparents and to their teachers and everybody else. So that would be a good positive argument to get them vaccinated.
Yeah, absolutely. And I think the really important point is that the vaccine, is helping to reduce the amount of people in hospital and those that are suffering, with severe symptoms. So that's obviously a really positive thing. Having said that, so if we know lots of people in the population, particularly children, have already had COVID-19 in the past. So why is it that now they should be getting the vaccine?
Yes, and we've had that asked that if they've had COVID, they will have antibodies, as I explained when we first started about how vaccines work in general. Why would they need to be vaccinated? And the answer to that is we know there is no denying that if you've had a virus, COVID or any other, you do develop antibodies. What we do know is that the length of time that you'll have these antibodies will be improved by the COVID vaccine. So until we start doing routine antigen testing on everybody that's had COVID, you will not know exactly how long this protection or the natural immunity will last. And that's the reason why we're having the vaccine, to give us that extra protection.
Brilliant, thank you. Dudu, is there any more questions in the chat for us to answer?
Yes, so thank you. There's been a really interesting kind of chat conversation happening. So thank you, Anon. for putting that information into the chat. So there was a report published by on the .gov website around the notifications that have come through the yellow card scheme about about COVID vaccination, and I've just been having a look at that, and what my understanding of the report is, and it's in the chat so people can have a look at that for themselves, is that whilst reactions can be reported, they are then investigated, and those reactions are not necessarily due to the vaccine. They are just reported as maybe being linked, maybe in time or within the same person. So they're not necessarily the vaccine causing those reactions there. So in terms of serious reactions caused by the vaccine, and that would include obviously the most serious being death, those numbers are much smaller than are in that report. So I hope that does provide you with some reassurance that those are not the levels of reaction that are, once investigation has happened, associated with vaccination. Belinda, I don't know, I know that you haven't had time to have a look at the link that's in the chat because you've been talking, but in terms of sort of information that clinicians have had around vaccination, who are the individuals, obviously particularly within this age group, who there may be a contraindication for vaccination for?
So I haven't had the chance to have a look at the report, but I am familiar with the yellow card and the summary of what's being reported in there. There are no contraindications to this age group. I really must stress that of the COVID vaccine, you know, to the children. It does, when you do the yellow card report, it does break down, and I'm sure that the report in detail will break down into age groups, but you know, it's like you said, you cannot, until they're all investigated, and a lot of them have been, there is no direct link to the COVID vaccine. It's difficult, and you can, you know, if you look at the numbers that I think somebody had put 684 in there, but I haven't quite seen the detail of it, and you look at the number of infections and the number of vaccinations that have been carried out, though obviously every side effect and every death is affecting somebody, and you know, it is serious. If you look at it in relation to the numbers, it's a very small number of the overall.
Yeah. So in summary, about that report, whilst they are notifications through the yellow cards, they are not necessarily, once investigation has happened, found to be linked to vaccination. I think the other important thing to think about is that once somebody has been vaccinated, whilst it doesn't prevent them from catching COVID, it does reduce the risk of them doing that, and it does reduce the risk of them therefore spreading it to other people. And whilst we know that children of this age are rarely seriously affected by COVID, obviously they are living in families with adults and you know, grandparents who may well be. So I think it is one of the more you know, one of the benefits of vaccinating is around protecting the whole community, not only the individual, which is obviously an important thing for everybody to consider as well. Are there any, I just wanted to encourage people on the call to put more questions through the chat. I think we might have exhausted Louisa's list of questions, so thank you to Louisa for putting those forward.
I wanted to actually ask for, thank you as well, Louisa. I wanted to ask for parents' help in preparing their children for this or any other vaccination, please. Obviously, once you've consented, I'm taking it that for a 12 to 15-year-olds, you would have had a chat with them to let them know that you consented to them having the vaccine. Do ask them how they feel about it. Ask them if they have any questions about the vaccines, and please reassure them that nothing bad is going to happen. Ask your child if they want you to be there with them. As I said earlier on, maybe for the younger ones, not so much for the older ones. Ask them if they want somebody to talk to during the injection. So some children like to come in, they like to be jabbed, and they like to go. They don't want any of that small chat, but some children want that, and you know your child very well, they want that distraction. So do they want somebody within my team to have a chat with them while they're being vaccinated, or would they prefer there to be quiet? We want to know that. If you have any special requests for your child, we want to know that so we can make them as comfortable as possible. And lastly, for some of the younger ones, ask if they want somebody to hold their hand for comfort while they're having the vaccination. So we've got a nurse there, we've got a support worker, we've got admin support who are helping us out, and they're all there. While your child is having that vaccination, it's about your child, it's about that young person, and whatever they need to make that time as painless and as seamless as possible. If you have any special requests, please just give us a call on the number that Louisa is going to give at the end, and give us your child's name, date of birth, and just let us know that, if you don't mind, can somebody sit with them? Can somebody have a chat with them? And, you know, keep them behind for an extra, 15, 20 minutes. If you want us to do that, just let us know.
Thanks, Belinda. And another important question has been put through the chat. Are around how we are paid for vaccination. So I just wanted to make it clear that in terms of the local authority, we are not paid to, obviously we don't provide vaccination, but we don't receive any other benefits in relation to the numbers of children or in fact adults who are vaccinated amongst our population. Belinda, are you able to answer how BEH are paid to vaccinate children?
Yes, I can. So we have over 12 to 16 nurses at any one time. As I've said, we're already there as a team to do the national vaccination for children. So, we're not going to get anything extra because we're promoting COVID vaccination or flu or any other vaccination. That is what we're there to do, is to promote the health and well-being of the children in the borough who are school age. So, whether we're doing COVID or we're doing flu or HPV or any of the national program, the team are there. And that is what we're there to do. So there are no individuals who are paid per vaccine or given an extra bonus for delivering it. These nurses, and I should have said myself at the top, actually, I'm a registered nurse myself. We're there for the health and well-being of our patients, and that's what we're there to do. So I can assure you that the average nurse is not really thinking about money when they're doing that clinical intervention. They're just looking at the best and safest way that they can deliver that intervention.
And there's another great question here as well in the chat about that we don't know the long-term effects of vaccination. And I think one of the things that I would just like to sort of mention in relation to this question is that in actual fact, whilst yes, the COVID vaccinations have been developed very quickly, much of the research that went into their development started many years before COVID-19 came into the world. If you remember back to the SARS outbreak that happened in, you have to maybe help me out here, was it about 15 years ago now? That was also a coronavirus, and research around vaccination for coronaviruses started then. And one of the reasons why the COVID-19 vaccinations have been able to happen so quickly is lots of different reasons, really. One, many governments across the world have made funding available for vaccine development. One of the challenges that vaccine pharmaceutical companies often have is getting volunteers for vaccine research, but there was a huge number of individuals who came forward to volunteer as within the vaccine trials, and so that was also a challenge that was overcome. But also what was allowed to happen was, so every vaccine goes through the same rigorous process in terms of its research and approval, and the same process, the same requirements happened for the COVID vaccination, the COVID-19 vaccinations, but rather than having them follow one stage after the other, they were done in parallel. And so there were many tens of thousands of individuals who were involved in vaccine trials in parallel with each other in the various stages of the vaccine research, and that's why they were able to happen and be developed so quickly. So I hope that goes some way to answering that question about the speed that the vaccine was developed in.
That was very thorough, Dudu. I've got nothing to add to that. Thank you. That's a brilliant explanation.
So I know that we are coming to the end of our session today. Louisa, do you have any other questions? Louisa, you're on mute.
Sorry about that. No, I don't have any more questions. I think the range that we've had in the webinar have been really comprehensive, and we hope that gives people some assurance now when it comes to vaccinating their children. I've put on the screen here some useful links. So these are in the chat, but if you'd like to access these beyond the webinar this evening, you'll be able to access them at these links. So there's some frequently asked questions. If there's anything else that we didn't pick up today, you can equally book your vaccine at the national booking system for your child, or you can also access one of the walk-in sites in Enfield at the link below, and it gives you all of the times, the days of the operating hours, and you can just turn up and have your vaccine there and then.
Thank you. Louisa, do you have the contact details for BEH as well,
Yes,
just in case?
Are you able to see them on screen? We've got an email address and a telephone number.
I think it's the next slide.
Oh, has it not moved on yet?
So just whilst we sort out the technical hitch, we will make sure that that is also in the recording of this session, which you'll be able to share with any friends, family, who you think will be interested as well. So Belinda, is there anything else that you would, thank you Louisa, that's really helpful. So just to say that please do, if you have any further questions or specific issues that you need to speak to one of Belinda's team in relation to your child, please feel free to email or give them a ring. Belinda, is there anything else that you would like to add today?
I just wanted to really thank you for inviting me on here, but also to thank the vaccination team. Though I'm here and it's my face you're seeing, it really is a big team effort behind me that are carrying out this service. Lots of dedicated nurses who have been, doing vaccinations for Enfield, for many years. I just wanted to say a big thank you to them for all the extra hours that they've dedicated, and we'll continue to dedicate our time to vaccinate your children and keep them healthy. Thank you very much.
Thanks, Belinda. Louisa, are there any other questions that would be useful at this stage?
Just to reiterate really that where people can have their vaccination, and just to highlight the fact that it's completely safe, for children, adults to receive their COVID-19 vaccine. But of course, if there are concerns, and there's lots of questions available, you've got the information on screen, and we just really like to encourage you to do so. And we hope that this webinar has helped in that decision.
Thank you. And so I'm just going to add that I also have a 15-year-old son, and I have consented for him to be vaccinated. He's received his first dose, and I'm now going to be booking him in with the National Booking Service for him to receive his second dose. He doesn't attend school in Enfield, so he won't be eligible for Belinda's excellent service. But I'm very keen for him to be vaccinated. So I just wanted to thank everybody who's taken the time to listen in to the webinar today. It's been really great questions, so thank you to those who've put those forward. I hope you have found it useful, and just to say, have a great rest of the evening, and thank you to our speakers as well, as always.
Thank you. Have a good evening, everyone.
Bye, everyone.
Bye, everybody. Thank you.